Okay, today we're going to quick go over how to approach step 2 CK questions. So let's start off with this question right here. It's pretty good size for a question. So I find this kind of question pretty common. So first, what you want to start off with is reading the STEM question. This is going to tell you what the question is going for. Sometimes you might not even realize you need to read that much in depth into here. So it's important to read this last question. And I typically like to use highlights, but you don't have to. So let's see if I can highlight. So the main question is, which of the following is the most appropriate next step? So that's the key part of the STEM. We're going to focus on management. Now, next step, I try to read a little 1 to 2 sentences before the STEM question, because sometimes they'll mention the diagnosis going on, or they'll give you some really important hint that may allow you to save time, like you may not need to read as in depth in here. So let's do that. It says here, the chest x-ray shows diffuse alveolar infiltrates bilaterally, no cardiomegaly. Following intravenous administration of fluids, blood pressure increases to 118/80. So right over here, I'm just going to quick highlight diffuse alveolar infiltrates that and looks like they gave him fluids. So looks like this is going to be talking about a guy who's having some trouble breathing, probably. Other thing I forgot to mention, for these kind of questions specifically, I think the best thing to do is for you to take a quick look at the answer choices. Don't spend too much time, just a quick look to get a sense of what they're going for here. We already know that they were looking at management, so just take a quick look at the what kind of options are there, but don't dwell too much time on it, just to get a sense of what they're going for. All right, so then I like to focus on the first line here. So this is about a 42-year-old guy. He's in the ED. He's got a history of progressive shortness of breath. We kind of already gather that from the main paragraph down here. It's a chronic cough, history of pneumonia. Okay, so I want you to quick stop there and notice his labs. Another thing that could be helpful to do to save time is to take a quick look at the labs. So you'll find here, sometimes instead of telling you their diffuse alveolar infiltrates right here, they'll just have a link to the chest x-ray. So even before you go deep into depth into this question right here, you should quick look at the chest x-ray if there's a link to the image, or if there's already an image out there, because sometimes that can give away like what's going on here right away. Now if you have labs here, I think it's also really good to do quick look at them before you even delve deep into this large paragraph here, just because it gives you a sense of what's going on. Okay, so hematocrit, I also like to highlight any super abnormal labs. Hematocrit, I think that's pretty normal, but you can check with your reference sheet. Pretty normal for him. Leukocyte count, that strikes me as elevated than what it should be. Yeah, it is. We confirmed that. And looks like he has a lot of neutrophils in there. So right there, that's telling me he has infection. Even if I didn't read this part right here first, I can already tell it's got pneumonia going on or some type of infection. Platelet count, they give you, that's pretty normal. And look, they give you blood gases here. So you can kind of tell what's going on here. So 7.35, that's a little low, but I think it's still kind of within the normal range. Yeah. PCO2 looks like it falls within good range, but look at the O2. The O2 is 55, so we know he's not getting enough oxygen there. It's probably why his pH is on the lower side of normal. So already we know he's got a problem breathing, and they've already given fluids, and that seems to have helped his blood pressure even before going into depth here. And we're talking about next steps. So already I'm going to know he's having some problems getting oxygen in. It's not like a metabolic issue, it seems like, based on this. So it's really coming more from the lung function. So we're probably going to have to mess around with the respiratory settings. See, already now I can start to already pick apart these. It's not going to be cyclophosphamide. How is this even related to this? We're not going to do that. Extracorporeal membrane oxidation, don't know what that is. Usually if I don't know absolutely what it is, I think just see if there's anything that makes sense. But if it's something completely out there, then I usually don't put too much emphasis on it, because usually your first guess is always correct. But yeah, already I can probably say this, probably not this, probably not that. So I'm already down to potentially 3 answers, and that's even before I even looked at this. So now we can take a look at this. And I don't have the strikeout feature here, but you can also strike them out once you start going through it. All right, let's go back. He had a shortness of breath. He had pneumonia. He's not responding to treatment as fast as we would like. He had a productive cough. That could be interesting to note. Shortness of breath while walking. He had a fever. There's no other history of illnesses. He's on erythromycin. He has smoked. He's ill, diaphoretic. Severe respiratory distress. Let's say he has a fever. Pulse is kind of up. Okay, this is pretty elevated right here. And his blood pressure was low before they gave him fluids. Okay, and his oxygen stat's not too good. Diffuse crackles that coincides with our x-ray. While a blood sample is being taken, the blood pressure decreases. He stops breathing. He's intubated and ventilated. Okay, that was a key thing we didn't know. He's already ventilated, and this is his blood gases. I assume after the ventilation. So now we put together everything here. So we already excluded some of these guys. So we're left with A, C, and E. So then it's just a matter of putting everything together and thinking about what it could be. So this one's continuation at the current setting. Well, if you look at it, all this evidence here showing us that he's not doing so well even at his current setting. His O2 is low, so that it can't be that. The last options left are administering dexamethasone and applying positive and expiratory pressure. So for this, I think we're probably going to be messing around with the settings because his O2 is low. This is a more urgent issue. I think probably you can at some point give dexamethasone here. But I think the more urgent issue right now is fixing his O2 stats and then also fixing this. So this is going to lead you to this answer right here. So all of this will occur at a much faster rate once you practice this kind of way of doing it. So just to recap what we did here, you're going to want to read the main STEM question. You could read a few lines before. You could take a quick look to see if it's going to help you. Most of the time I find that it does. So I try to read at least a sentence before. And then if you see any images or labs, just go for it. Look at it, because it might tell you what's going on here right away. Note any abnormal labs that are there, and then you can start going through the question. Oh, I forgot another step. Also, looking through your question answers, just take a glance. You don't need to go as in depth, just to get a sense of what's going on. And then you're going to go through your question. If you would like, you can also highlight. I really like highlighting. So I do that and kind of highlight the key things. You don't want to highlight everything, just key things that stand out to you based on what his chief complaint is, which is shortness of breath. So here I highlighted relevant stuff like his cough, fever, he was on a medication. Looks like his vitals, he had high temp and he's having some trouble breathing. And his O2 stats are low. So another thing you can try with big questions like this, and I only recommend this starting out when you're kind of new to this, and you're still learning all the material. I find it kind of neat to kind of put together the whole picture, is to do some note taking. Now, on the real thing, you probably won't have time to do this, but that's okay. It's a good practice. So how I usually do it, again, I look at the main question and I quick type in here. We're going to focus on next step. His chief complaint is shortness of breath, and I know some quick key things for him. I've already done this through highlighting, but you can write it a note from here. Cough, it's a fever. He's on erythromycin. O2s is 83%. Neutrophils up. So there's some things I might have noted here, and this is really helpful if it's a long paragraph. You might encounter some that are even longer than this, and this can be super helpful for that, to practice doing some of this notes, to get you kind of in that mode to really focus on a question. The other time it might be helpful to do notes on the actual exam, and I think the only reason why you would do it, I would advise against doing note taking on the real exam, because your time is super tight, is towards the end you might start to lose focus. I know that happened to me on the test. So kind of towards the later end of the test, once you're hours in, you might find yourself losing focus. Your mind might start to wander because you're so tired. And that's when I quick implement this note taking right away to refocus myself quickly, so that, I kind of reorient to what I'm doing here. So that's the only reason why it'd be helpful, but I don't advise doing it that often. Just if you need it. It's a crutch there and you've already practiced it, so you know. All right. Now, the only other variation to the methods that I find helpful is I couldn't find a good example within this question set, but you may find some questions where you have up, down arrows and a whole set of them, like the pH, the O2, what would happen in each of those categories, and they might have up, down arrows, or they might have actual values on here. Like they might ask you, what would the settings be? What would these O2 measures be? I mean, these blood gas values be once you change the PEEP? That might be a question. And they may have actual numbers, or they may have up and down arrows. So instead of looking at the answers, I would not even glance at those. If you notice they're like that big chart form questions, don't even look at it. Just skip that step. Just look at the main stem and go through all the step. Then, once you've kind of synthesized everything and you're ready to answer the question, don't look at the answers, but kind of like think about what the answer could be. If they're talking about pH, PCO2, and PO2, just think about what did they do here? What did the change? What was the change they implemented? And what do you think it could be? Like if they changed the PEEP, and you would think that the pH might increase a little bit. So it might go up. CO2 might stay the same, maybe. And your O2 might go up because it's already low. So already there you've got an idea of what it could, what the results could be before even looking at it. Because you'll find that there's so many options there that you might get confused and disoriented, or at least I did. So actually thinking about what the answer, predicting it before you even look at the possible answers, really speeds up eliminating options instead of going through each one and figuring out if that's right or not. And oftentimes it's not as easy as this. They'll throw some type of other factor in here that's not typical of a blood gas, but is some kind of pathophysiology. So it's some like unknown factor. So you'll probably have to do one more step of thinking in addition to that. But this is super helpful for those questions so that you right away can eliminate questions. Now you can do those with these questions too, but I find that less helpful than for those pathophysiology questions. But that's a tip. If you run into questions where there's up-down arrows or like you're trying to predict what's happened in the physiology. All right, let's do one more, applying what we learned. So we're going to look at the main STEM question. Here it says, which of the following is the most likely diagnosis? So that's a key word here. We're looking at diagnosis. I'm going to take a quick look at the options here. Looks like this question is going to be about bleeding or platelet disorder of some sort. All right. Now the lab is going to take, there's no follow-up, questions up, or not questions, sorry, sentences up here to really look at, but there are labs. So we're going to take a quick look at the labs. So hemoglobin, that looks really low. Erythrocyte count, I'm not sure. See if I got it on here. I might not have. Is that on here? Yeah, I might not have that on this one. Oh yeah, it's on here. Erythrocyte count that's low. Okay. Leukocyte count, that seems a little high. Platelet count's normal. Prothrombin time, that looks normal to me. Let's double check the PTT, that might be long. Okay, it looks like it's elevated, so let's highlight that. All right, now that we got those highlighted, we can even start to think about what this could mean. So this person has anemia. His PTT is elevated, so you can already start to think about what coagulation factors are involved in that. That's going to be, I always kind of messes up. I think 7-9 and some of the other ones, protein C and S. So just keep those in the back of your mind. They might apply to these. All right, back to the main part of the question. It says it's 27-year-old man comes to the physician because of a history of fatigue. That makes sense. He's anemic, as we saw. Episodes of abdominal pain. That's kind of interesting. Could be a GI issue. He has 4 years history of recurrent nosebleeds that have increased in frequency despite undergoing cauterization of the nasal mucosa 6 months ago. He takes no meds. His sister has anemia, so that's family history right there. Associated with recurrent nosebleeds and heavy menstrual periods. She also has postpartum hemorrhage that require transfusion. Vital signs are within normal limits. Exam shows pallor, no other abnormalities. Okay, so let's look at our options here. I feel like already we can eliminate hemophilia A. His sister has similar conditions, we think. And hemophilia is an X-linked disorder, so his sister shouldn't have had it, most likely. So I think we can safely eliminate hemophilia A. The other one I'm thinking about eliminating is hemorrhagic telangiectasias. Just because it doesn't seem to fit here with the PTT being abnormal. I don't think you would have that abnormal. You might have anemia, but I don't think that would be that. So we can, I think, safely eliminate C and D. And the rest of these, I think, are platelet disorders of some sort. Now, these I haven't seen. A and B I haven't seen since step 1, so I don't know that much about them. E, I have heard about. This is kind of common disease that shows up on CK, so I have seen that a couple times. So already I'm kind of leaning towards that just because it's more common, unless there was something that they hear that seemed unusual. But I do recall, just knowledge-wise, a knowledge thing too, is that von Willebrand can kind of look like hemophilia a little bit, which we might have thought about maybe because of the PTT. I think because that involves like factor VIII, I believe, and for hemophilia, I mean, so we might have thought that the PTT might be off, but I think that's also factor VIII is also can be a little affected in von Willebrand disease, but not nearly the same by the same etiology as hemophilia. So I think that's probably where answer's gonna be, as opposed to A and B. Honestly, I don't know too much. I've forgotten since step 1 about them. But they sound to me like a lot rarer diseases. And I noticed in the CK that they also kind of think about this too, as in rare common diseases, to think about that when coming up with your answer. But anyway, this all seems to fit the von Willebrand disease, so we're going to pick that for now. But I hope this gives you examples of how you might approach questions and get to your answer.